Welcome back to Cheddar's Opening Bell. Coronavirus cases continue to rise in new hotspots like Texas. More than 254,000 cases have been reported in Texas, according to Johns Hopkins University. More than 3,100 people have died. We should note that more than 132,000 people have recovered thanks to the work being done in hospitals on the front lines of the pandemic. We're now joined by one of those doctors, Dr. Owais Durrani, who is specializing in emergency medicine at UT Health San Antonio. Doctor, it's good to have you with me this morning. You did just finish an overnight shift at the hospital. I commend you for all the work that you're doing. Tell us what it looks like inside the hospital for COVID patients in Texas.
Thanks for having me. Just seeing a bunch of COVID all over the place. So thinking back to the shift tonight, I saw about 80% of patients that had COVID-related complaints or illnesses. The other 20% that I saw coming in for things like ankle sprains or motor vehicle accidents, some of them got admitted. When they get admitted, they get a COVID test. And a good number of them came back positive as well. So even patients not showing up to hospitals for COVID end up testing positive. The other thing that I've noticed over the past few weeks is a lot of these patients are boarding in the emergency department. So the ICUs are so full that when we need to admit these patients, there's no room for them, so they stay in the emergency department. Now, we love taking care of them down there, but the issue is we have a limited number of physicians and nurses down there. And so sometimes they may not get the close monitoring that they need that an ICU would give them. So that's something that's been alarming that I've been noticing more and more over the past few weeks.
Doctor, is it mostly young people? Older generations? Who are the people? What's the age demographic of those who are coming into the hospital testing positive?
Yeah, so, compared to March and April in Texas, we saw a lot of older kind of nursing home aged patients. That's changed over the past month or so. Thinking back to the last week, most of the patients that I've seen that have come in have been in the age ranges of between 30 and 50. Now, of course, you still have your older patients, but just because these patients are younger doesn't mean that they're not sick. A lot of these patients are still requiring very high levels of oxygen and requiring ICU admissions. The thing that really worries me is that we don't live in a bubble. So these younger patients who are positive have parents, friends, other community members that are going to be older. And so what happens when those individuals get sick? Our ICU capacity and our ability to help those people, is that going to be there because of how much strain we have on the system right now?
In terms of the particular hospital that you work at, Doctor, when will you hit capacity? I know you're at capacity in the ICU, but even with the availability in the emergency rooms, when does this become a serious problem?
It already is a serious problem. As you mentioned, we hit ICU capacity a few weeks ago. We've expanded into surge capacity numerous times, and there's only so much that we can do when it comes to surge capacity. The issue is that when New York was seeing a similar number of cases and ICU capacity numbers, they were in a complete lockdown. We are not in that complete lockdown in Texas. So we're still seeing a record number of cases and now, unfortunately, a record number of deaths. And that trajectory does not look good if we don't change something right now.
How is the hospital doing and the doctors there in terms of PPE? Do you have enough of it?
So right now at the hospital that I'm at, we do have enough PPE, but I've heard from other colleagues across the state that there are some shortages that are coming up again, and that's unfortunate. That's something that was one of the first things that we should have taken care of back in February, March when COVID hit the United States. And it seemed like we did, but then we let our foot off the gas. And now we're starting to see some shortages around the state. And I'm hoping that doesn't come into San Antonio, but I'll be keeping a close eye on that.
Do you feel safe as a doctor there?
I do, yes. At my hospital, I feel very well supported when it comes to PPE, when it comes to getting things like mental health support, when it comes to showing up in the morning and knowing what to expect. And of course, in these COVID times, we've had many, many challenges when it comes to the day-to-day care of the patients. I think our hospital in particular has done a good job. I think local communities, whether it's the county level or the city level, have done what they needed to do to combat this virus. I think the issue becomes some of our leadership at the top haven't supported us to the extent that we need to be supported.
What more support would you like to see from that leadership, Doctor?
So as I mentioned, we are still seeing a record number of new cases, and that is not going to stop unless we take some drastic measures. And that starts with considering new lockdowns. That also starts with having leadership really push forward things like basic public health measures. The unfortunate part of the situation that we're in right now is that we had all the answers to this test. We saw what happened in Europe. We saw what happened in New York City, yet we did not learn from those mistakes and those things. And now in Florida, in Texas, and many other places, we're making those same mistakes again. And so I really hope that our leaders in Texas and in some of the other surging areas look to what was done in New York City, in other places, take those lessons to heart and make swift actions right now.
Doctor, we've seen reports of COVID parties and one man actually in San Antonio dying because of it. What's your message to young people, to people going to these COVID parties and the risk that they put the general population at?
You know, we've heard it time and time again, this virus does not discriminate, and that is true when it comes to age as well. It will, behave in ways that we don't expect it to, and it will make young 20-year-olds as sick as 90-year-olds. And so I say, save the parties, save the celebrations, save the good times for 2021, 2022. Right now, we need to focus on our communities, our families, and those around us, and make sure that we have something to look forward to.
Dr. Owais Durrani with UT Health San Antonio, thank you so much for chatting with me today, and good luck.